So I'm thrilled to be joined now by Dr. John Liddicoat. John is the Senior Vice President of Medtronic and also the President of Structural Heart. Is that right?
That's right, Randy.
Thanks very much for joining me, John.
Good morning, my pleasure.
So, John, tell me a little bit, what's your, you have a unique perspective in that you're both a cardiac surgeon and an industry. What do you think is the state of mitral valve surgery today?
Well, when I look at mitral valve disease as a whole, generally speaking, I don't think we've ever had a better understanding of the pathophysiology of the disease, the morphology of the diseased valve, and the benefits of the treatments that we have to offer. When I look at the treatments, I don't think our outcomes have ever been better.
Right.
Clearly I'm biased. I look at the practice of cardiac surgery, and I've watched it evolve. My father was a cardiac surgeon. I started my training in 1990, trained through the 90s, which was really a great time to be treating mitral disease. If you look at the real blossoming of our understanding of the disease and the therapies themselves, that was really an era where we showed tremendous growth.
Absolutely.
I couple all of those positive comments with a caution that, from my perspective, we still have a huge number of patients out there who are suffering every single day, who have symptomatic mitral regurgitation. And I look at the treatments we have to offer, I see the clear-cut benefits. I have to ask myself, why? Why aren't we reaching more patients?
More patients, okay.
I'm not sure we'll ever be able to offer them a survival benefit with our interventions. I think we may be, but I am confident that we can make them symptomatically better.
Absolutely. So I agree with you. In my early days at Stanford years ago, the advances now in surgery are dramatic. So John, put on your future cap. So where are we going in the future with both mitral and tricuspid disease diagnosis treatment worldwide?
Well, just look over the course of your lifetime in terms of seeing the benefits of the therapy and then seeing the unmet patient need. And just over the course of your career, that as things have become less invasive, we've done better at penetrating and treating those disease states.
Absolutely.
So I am 100% convinced that we will continue to see an evolution. It'll be a slow incremental evolution, but we will continue to see an evolution towards less and less invasive therapies. But at the end of the day, I believe that we are going to be treating these patients with interventions.
I don't think there's any doubt. Do you see a role for us as either physicians or for industry to really be focused on patient education, patient awareness? We're really rapidly moving toward, mobile phones, everything. What's the role in getting consumers to be a part of the sort of the diagnosis and the answer?
Yeah, well, there's no doubt that these days the consumers are part of the answer in anything that you have to offer. And also, as you mentioned, I do have a unique perspective on kind of the clinical side and then also the industry side. But I'm so biased towards the clinical side that I always say that there is no industry benefit if there isn't a clear-cut clinical benefit to the patients. And then as a physician, anytime you go in for a conversation now, if you don't have a clear-cut benefit to the patient, that no matter how great a salesman you may be, you're not going to be able to sell your intervention to that patient and importantly to their family as well. If they're coming in, they're much more sophisticated. They want to have a sophisticated conversation about repair versus replacement, minimally invasive versus standard approach. And those conversations, in my mind, are only going to continue to evolve to become even more and more sophisticated.
Well, no, you're exactly right. I think it's a really exciting time on all fronts. So, John, final question. This is a phenomenal meeting. So what's your take on a meeting like the Mitral Conclave?
Well, congratulations to David Adams and to his team and then to the broader faculty. Because when David first ran this concept by me a few years ago, well, and I get approached a lot with concepts for a meeting and this and that, but when he said it, it really resonated with me because it was filling an unmet need that we have in education. That we have the big congresses and then we have a number of smaller symposia that are really regional symposia. This to me is a perfect in-between ground. The cadence of every other year to make sure there's new topics to talk about, to be talking about some very basics in terms of mitral disease, and then to be talking about some really sophisticated topics as well. I think provides the audience with a full snapshot of the current state at this time. So I think it's really a great meeting. I think a lot of people love to come to New York New York is a good draw. It's actually easy in and out for our international crowd.
Sure.
And it'll be interesting to see where it goes next, because I do know that one of our greatest educational needs is internationally.
Absolutely.
And the more momentum this meeting gets, it'll be interesting to see how exactly David and the team continue to broaden the attendees, or perhaps even
sure.
Whether it's piping internationally now with technology or having regional meetings in other areas. It's going to be fun to watch.
Well, listen, John, thank you so much. I appreciate your, not only doing the interview, but where you stand both as a surgeon, looking out for the technology, the patients, and as industry. So thanks very much.
Well, thanks, Randy. You've been a
Appreciate
great partner.
your time.
Yep,
Thanks,
great to
man.
see you.
Good to see you. Thanks.